Hey everybody, Dan here with Pain Free You. Today I wanted to talk about this concept, tolerating pain versus teaching the brain. And this concept came up in a group coaching call where somebody was saying that they've been tolerating pain for decades. And what we realized in conversation is there's a huge difference between tolerating pain, and many of us just live with our symptoms, we tolerate them, versus actually teaching the brain. And while it may seem subtle in our actions, it's actually massive in our impact on how we see, perceive, react to, respond to the symptoms. So I'll get to that in a second. Don't want to forget. Breathe in. Smile. Lower your shoulders, loosen your body. So, comment below if you're tolerating your symptoms. You get by. You make it through the day. But in many cases, tolerating symptoms while grumbling under our breath is not conveying that I'm okay and these are temporary, right? I talked about this in the Language Matters video a few days back. And I think it's really important because a couple of people actually commented and says, you know, Dan, I made a commitment. I stopped talking about and complaining about my symptoms with others. But boy, if I realize it, my internal dialogue, my thinking has been still very negative, complaining, suffering, victimized. And so we have to do our best to improve not only the outer conversation, but the inner dialogue. So, again, tolerating symptoms to step above panic and freak out. But it's not quite far enough. And so tolerating symptoms doesn't teach the brain anything other than, yeah, they're there. I don't like them. Or grumble under our breath. And the brain doesn't really learn that these symptoms are unnecessary or false alarms. So what's the difference between tolerating in an annoyed, frustrated state versus teaching the brain? Well, we do our best to elevate our state, our mindset, our belief system, our can-do attitude as much as possible. Now, we don't need perfection. Maybe you can get slightly better tomorrow than you were today. Maybe you can respond a little bit better tomorrow than you did today. And so it's a practice, it's baby steps, it's little bits of progress, and in group this week I was talking about how we're continually off course. This is not a straight line from here to the finish line where we're symptom free. We hear about concepts, we experiment with them, we try them a little bit, we evaluate how did it go, and then we adjust. And then we try it again. And then we evaluate. And then we adjust and we try again. And if something seems like it's benefiting us, we do that over and over. But if it's not working, we say, well, what else can I try? And so it's a practice. It's iterative. It is not a straight line all the way. Boom, you're all done. So, are you tolerating your pain? If so, that's wonderful. That's way better than panic and freak out. But for the people who say, Dan, I'm living my life, how come I'm not better yet? Somebody else was just telling me minutes ago that I understand the concepts. Dan, I can quote you. But then in the next breath, they are saying that, with all the symptoms they've got going on, it's hard for them to believe that it's all coming from a brain perceiving danger and that there must be something else going on because they feel really awful. And to that, I say, I get it. I've seen that over and over again from countless people over the number of years I've been doing this. But how awful you feel is not proof that you're sick or broken or, flawed in some way. How awful you feel is relevant to the amount of doubt as to what's causing it, and the subsequent amount of fear that's caused by that doubt and worry that you really might be sick or broken. Now, disclaimer, if you're not sure what's going on, go rule out anything significant with the doctors. Medically, am I sick? Is there an infection, viral, bacterial? Do I have some kind of disease? Let's rule out tumors, cancers, any lung or heart issues. Let's rule that stuff out. But then we use the assessment. I know you're sick of hearing about it, but we use the assessments, the mind-body assessments, to start to rule in where are my symptoms coming from. And some people are like, so I'm supposed to do this on all the symptoms I have? I might have 100. Well, for the vast majority of them, it's pretty clear the mind is creating the symptoms. But for any symptoms you have doubt, run that doubtful symptom through the assessment by itself. The assessment's linked down below. It's at painfreeyou.com. So look for it. It's always in the description, as are all my resources. So, how are you teaching the brain that you're okay? Starting to expect better, starting to respond as well as you can, but that's built on a foundation of clarity, trust, accurate knowledge of what's going on, and the assessments to say, this is what's going on for me. And then when we start to make a decision that goes, yeah, I'm definitely dealing with perceived danger, it's a mind-body condition, neuroplastic, whatever term you like, guess what the brain starts to do? It starts to use the reticular activating system to look for evidence that what you believe and what you have just decided is actually true. Then you're going to start to notice, well, I was out with a couple friends, and I wasn't really thinking about my symptoms much, and as a result, holy cow, I felt much better than I normally do. My normal symptoms that plagued me most of my waking hours, they were not present, and if they were not noticeable, which meant they were significantly down. So, engaging in life while being unbothered by any presence of symptoms teaches the brain that you're actually okay. The brain has no choice but to notice, hey, look at Dan. Dan's doing normal stuff, and he's not really thinking about or trying to fix or solve or get rid of any symptoms, so that must mean that he's actually okay. So, super important. Don't tolerate your symptoms. Don't tolerate your pain. Teach your brain through clarity, foundational, mentally, physically, emotionally, how you respond, how you treat yourself, engage in life. Live more, fix less. You're not broken, you just think you are. So, love you folks, and as always, we'll see you tomorrow. Take care.